Let's talk about what the NDP wants here. What do you think would come or could come from the Auditor General on this, and what type of difference it could make?
Well, just from listening to David, I didn't really hear an explanation for why some of the non-hotspot locations are getting vaccines, while locations like Scarborough and many of our communities in Scarborough that are, facing 22%, 24% positivity rate are not getting the vaccines that we need. So I mean, and I want to be very clear, we really sincerely hope that that's not what happened in terms of the politicizing of this, and that would be an awful, disgusting thing that's done by the government if that is the case, because what I'm seeing is Minister Fullerton's writing, the government House leaders writing, for example, which are not facing the same type of crisis that we're facing in Scarborough. In Scarborough, we have essential workers, racialized communities, people who are having to go out there, risk their lives, and work on the front lines. And these people are still at risk, and they're not getting their vaccines on time. So when I hear David, just toe the party lines and talk about his talking points, I don't see an explanation. And meanwhile, we've had to call over 10,000 people in Scarborough who had their vaccine appointments canceled, and 2 of our large sites that have shut down. And frankly, we should have, from the beginning, had a large amount of vaccines given to areas like Scarborough, for example, and other parts of the province. I'm not saying that, just prioritize Scarborough. I'm saying that prioritize areas that are hard hit. We know that Scarborough was one of the areas from the beginning of the pandemic where people are suffering. I have a 97-year-old constituent in my riding right now in Scarborough Southwest, a 97-year-old who has been eligible since phase 1 of the vaccination rollout, and he still hasn't gotten his vaccine.
Why not?
Now, so Doly, to answer your question,
but why not, Doly? Why hasn't that person gotten their vaccine, Doly?
Because he's homebound, and right now we have, for homebound folks, we don't have the capacity to vaccinate people. So recently from the city, we found out that they're vaccinating about 40 individuals per day. For the rollout. So Toronto Public Health has informed us that they currently has the capacity to vaccinate 40 people. Meanwhile, we have 12,000 people, around 12,000 people in Scarborough who are homebound waiting for this. And that's just Scarborough. I mean, if we're looking at the city, that's about 75,000. So this is a complete disaster when we look at the rollout, whether it's talking about seniors, whether we're talking about 18 plus, whether we're talking about essential workers, educators, in all fronts.
Let's hear from David. Sorry about that, David.
Let's address that, though, because I think there are some significant issues with respect to the consistency of the supply. And you heard from Dr. Davila. I mean, Doly was asking about those cancellations and the question that she has to answer. And in addition to politicizing this process, which is deeply concerning, the fact that they have done that and are calling into question the independent advice of our healthcare professionals. But the bigger issue here, with respect to those cancellations.
No, but David. Right now, we're calling for the Auditor General. David,
here is with respect
you know very well. You have the data. You have the science in front of you.
Dolly, we get it. We can all agree that if we had enough supply like other countries.
But can I just finish the point? Is Dr. Davila said today that every vaccine has an arm it's going into. So what Doly has to answer is which cancer survivor in Ontario is she going to cancel the appointment to then get someone else in her community vaccinated? And I would say, let's not play politics with it. I would say let's let our healthcare professionals make these decisions, guiding government, and let's work together.
David, but it's up for debate, right? Because people on the science table have suggested that you offer paid sick days and you target communities that are hardest hit. Warehouse workers, that's advice coming from the medical officials as well, right? So everybody has a different opinion. If we had enough vaccine supply, we wouldn't be having these political arguments. But I think the clarity here for anyone looking to get a vaccine right now is to understand how do you do it and who's responsible. Mitzi, if there was a provincial plan to book an appointment, because now we're seeing public health units taking it on, we're seeing these mobile pop-ups, sometimes you need an appointment, sometimes you don't. Do you think that if we started with one provincial plan, it would help with the confusion?
Well, we know
absolutely. The issue is that we do not have a consistent plan across the province that's evidence-driven, data-driven. You know, we received 855,000 doses of Moderna vaccine yesterday. We know that there is a supply chain that has to be planned for, distribution that has to be met. But what we lack in this province is an upfront plan that's consistent. It was the Premier's decision to open it up to 18 and over in hotspots, but there was no capacity to book. There was no ability to fulfill those vaccines, because we see that now that there is a shutting down of the hospital-based vaccination clinics that are vaccinating people 50 and over. It is completely confusing, and it's really unfortunate because it's putting more and more people in areas like that I represent, that Doly represents in Scarborough, at serious risk because the variants of concern are even more deadly than the first wave.
David, I wonder, David, if there is so much confusion and there are so many different systems that are rolling out these vaccines in different ways depending on where you live. We're seeing thousands of appointments being canceled. Do you think that some members of the public just won't bother to even book an appointment because it is just that confusing and they really don't know where they stand in terms of their eligibility?
Well, with the greatest of respect, I think the confusion being caused here is in relation to what Mitzi Hunter just said. I mean, she said we've got to rely on science and the data. And science and the data has prioritized these regions where we're launching mobile clinics, where we're working around the clock to get vaccines via pharmacies, the pilot projects that were in the colleagues that I have on today. Those weren't in my ridings where those pilots were. That's listening to the science and the data. And Mitzi Hunter herself just earlier alluded to that. So I think the issue here really with respect is to the supply and to getting that stable supply so that we don't have to cancel it. And again, what Dr. Davila said today bears repeating. This is an independent doctor who said every vaccine in this province has an arm that it's going into. So what we haven't heard Stephen Del Duca answer, and what I haven't heard any of my colleagues answer today, is who are they going to cancel? What cancer survivor in my community? What dialysis patient across the province of Ontario? Because that has been decided by science and by our science table.
But David, obviously we all have to work together. Everyone's life in this province is important. But the issue here is that the coordination, the planning of the distribution has been an utter failure. And that failure is the responsibility of Premier Ford and his government for the lack of planning. I have many seniors in my community in Scarborough that have not yet received their vaccine. And this is an enormous concern. And, when you have the hospital clinics, operating, this is the largest clinic in Scarborough, and it has had to shut down and cancel 10,000 people who had booked their appointment. And I do worry that some of those individuals will be missed because they won't trust the system.
We work together to get more supply in this province. We've leveraged the supply chains of pharmacies incredibly well. We're seeing this throughout Ontario now. Our mass vaccination clinics that rely on that Moderna, and I've factually given you evidence, the delay at Easter, the delay this month with Moderna, not once have you said, hey, let's work together. Let's work with our federal counterparts.
David, hold on. If I may just interrupt. We have. I have on multiple occasions called on the Minister of Health. In fact, we have given a list to Scarborough Health Network for mobile clinics. We have identified areas in our riding across Scarborough as well. I think people are ready to work with you. Community leaders are ready to work with you. Everyone is trying really hard. In fact, we didn't even want the government to take a leadership position. You just had to be a team player. I mean, and I'm not letting the federal government off the hook. I understand that there is a delay with the shipment, and that's a failure on their part. But you gotta take responsibility for your failure as well. And your government has failed and done a terrible job of the rollout, because there are tons of people that had just got their vaccination appointments canceled, and there are tons of people who didn't even get slots. In Scarborough, when we talk about these mobile clinics, we didn't even have those clinics set up. Like in my riding, for example, we didn't get any clinics set up yet. So if you're talking about going to a mobile clinic, for example, you're expecting an essential worker to take one train ride and 2 bus rides to get to an appointment.
It's a tough conversation, guys. We're gonna have to wrap it up right now. But I do appreciate.
You still haven't justified why Minister Fullerton's riding, which is not
okay. We're gonna get into LTCs on another night. I appreciate all of you making time for us on CP24 tonight. Thank you very much, Doly Begum, David Piccini, and Mitzi Hunter. We hope you'll all come back.
Thank you for having me.
Absolutely. Thank you.